Is it the case that if, for example, the fellow who worked on an autopsy, would that person be supervised by somebody who is here permanently?
Yes.
Now, if there was a situation where the chief medical examiner is retired and the person who conducted the autopsy under his supervision has moved to parts outside of the state of Florida, for example, would you be able, based on your training experience, be able to review that autopsy file to come up with your own impressions of what the cause and manner of death would be?
It's not unusual. Life is life. People move on. We don't live forever, or we retire. So cases can come to court after the fact, and in those circumstances, we should be able to sit down, review the case with the information available, and form an independent opinion. Because if the case is well documented, and it should be at a high standard, you should be able to review it and form an independent opinion.
Right away, the prosecution is laying an important foundation here. The original medical examiner and supervising doctor aren't testifying, so the jury needs to understand why this witness can still offer an expert opinion. In forensic pathology, that's not unusual. Experts often review well-documented case files and reach their own independent conclusions. The key question for the jury: how reliable and complete was the documentation left behind?
I want to call your attention now to Miami-Dade Medical Examiner case number 2022 or 2022-02732.
Yes.
Have you become familiar with that case number?
Yes.
And in fact, in preparation for your testimony, were you given copies of all of the medical examiner notes, reports, photographs, and the like?
Yes.
In reviewing those documents, were they sufficiently thorough and detailed that allow you to tell this jury a bit about the cause of death of the person who was autopsied under that case number?
Yes.
Who was the medical examiner that oversaw that process?
Dr. Hutchins.
Do you know a woman by the name of Dr. Brittany Imblum?
I do not.
Is it your understanding from reviewing the notes that that is the doctor who was the fellow at the time working under the direction and supervision of Dr. Hutchins?
Yes.
First, I want to ask you about that case number that I read to you, 2022-02732. Can you explain what the significance of that medical examiner case number is?
Each case, when it arrives to the department, each case is assigned a unique number. They come in a sequence, so there's a case before and a case after, but there's a sequence of numbers, but they're all unique to that case. No other case will have that number.
And when you say case, are you referring to person?
I am referring to a person or an investigation of a death that may involve a whole, part, or some persons.
Now, in order to ensure that, let's say, photographs or specimens that are collected from that person or case will be only dealing with that person or case, is there anything done with that case number to ensure that it doesn't get confused with any of the other cases?
Well, in each case, the number ascribed to that case, for example, in the photographs, they'll all have the unique number present in the photographs. All samples will be labelled with that number. The case file will be labelled with that number. Everything that's generated for that case is attached with that number.
Do you know the name of the person who was assigned that case number?
I don't offhand, I do not.
Would reviewing the medical examiner autopsy report
Yeah,
help
and
you?
please, I just want to be clear, it's no disrespect to the deceased. We have to remain impartial, so I try not to learn the personal aspects of it.
Can you please take a look at this protocol and tell me if this is the protocol you reviewed for your testimony here today?
Yes, it is. It is.
Okay. And what is the name of the person who was autopsied under that case number?
Luciana Fernandez.
What was her date of birth?
Her date of birth is not given in this protocol, but if you give me 1 second.
Would that be noted in the investigations report
It's
that
in
went
the-
along with this?
Which I do not have, correct. Thank you.
You're welcome. Is that the investigations report that was part of that case file for Luciana Fernandez?
Yes, it is.
And what was her date of birth?
It states that she's 17 years old. It does not give me a specific date of birth on this file.
Now the case becomes much more personal. We're no longer talking about a file number. We're talking about a 17-year-old girl. Notice how the witness initially avoided learning personal details to remain impartial. That's actually a common practice among forensic experts. Their job isn't to advocate for anyone. It's to follow the medical evidence wherever it leads.
I don't see it.
You don't see it under her name?
August 26, 2005, excuse me.
That's
yes.
okay. Does the investigations report also include information as to the date and time that she died?
Yes, it does.
What is that?
September 5th, 2022 at 6:30 a.m.
And where was it that she was pronounced deceased?
Kendall Regional Medical Center.
Are you aware of a type of photograph that's taken at the medical examiner's office called a legal ID photograph?
Yes.
Can you explain what that is, please?
It's a photograph taken of the person's face, usually upper neck and face, full features, to assist or be available to help with the identification, so it may be shown to a loved one or person familiar to confirm as part of that is the person that we think it is.
I'm showing you what is in evidence of State's Exhibit number 7. Now, you had the opportunity to familiarize yourself with the photographs that were associated with this case, correct?
Yes.
Showing you State's Exhibit 7. Is this a legal identification photograph of Luciana Fernandez?
Yes.
I'm going to show you an exhibit. It's State's Exhibit number 1 in evidence. Do you know this person?
I do not.
Do you know any members of her family?
I do not.
Let's start with some basic information about Ms. Fernandez. How tall was she?
5 foot 5 inches,
How much did she weigh?
135 pounds.
When she was brought to the office of the medical examiner, did she have a condition known as anasarca? If I'm
She
not
did.
mispronouncing it.
No, you're pronouncing correctly. She did have a condition called anasarca.
Could you explain what that is?
Anasarca is a condition where the body swells, fluid seeping into all tissues. It is a terminal condition which may arise for a multiple of reasons, but its presence tells you that the organs have failed.
This is a major moment in the testimony. The medical examiner agrees with the official finding of drowning, but adds an interesting nuance: complications of drowning. That distinction may sound technical, but it reflects the fact that Luciana was resuscitated and received extensive medical treatment before ultimately passing away. Same overall conclusion, slightly different medical wording. Do you think that difference matters, or is it just semantics?
And this person has been in terminal decline for hours before their death. It can be days or weeks depending on the case, but ultimately when the body is swelling like that, it means that the organs have failed.
Doctor, do you have an opinion as to the cause of the death of Luciana Fernandez?
Having reviewed all of the evidence that was provided, the photograph, the autopsy protocol, the circumstance of the case, which is clearly very important to us, the cause of death in this case was determined to be drowning. I would agree with that. I would have used slightly different language, complications of drowning, but that's a style, not a difference of opinion.
Why would you say complications of drowning as opposed to drowning?
I use that term if the person, if you retrieve the heart function, depending on the circumstance, if the heart function is restored, technically they're still alive. However, the consequences of the damage done for whatever is the initial insult cannot be overcome, and therefore it ultimately causes the death. So I call it a complication of it. It could be blunt force trauma, it could be gunshot wounds, but in this case it's drowning.
Would you please describe the evidence of medical intervention that was done to try to keep Ms. Fernandez alive?
Objection, Your Honor. 401, 403.
But there were many things done. So once she was recovered from the water, attempts at CPR were initiated. They were quite aggressive, as you would expect it to be. It was quite sustained. It went on for quite a period of time, from time of retrieval to transfer to hospital. On arrival to hospital, these attempts continued at resuscitation, which included attempts to restart the heart, which were successful. They would have done many other things, taken blood samples, added fluids, and so on. Got an airway, which is putting in a tube to start allowing for air to be, oxygen to be put back into the lungs. So all of these are done as part of resuscitation.
After Ms. Fernandez died and her body was transported to the office of the medical examiner, will there be a photograph known as the receiving photograph?
Yes.
Can you explain what that is, please?
On arrival, the body or patient or person is photographed as we received it. Literally, the way it came in, we take a photograph so that we document this is how we received the person.
When Ms. Fernandez was brought to the office of the medical examiner, did she have injuries that were consistent with sustained attempts at or sustained amounts of CPR, cardiopulmonary resuscitation?
She did.
Can you describe what you're talking about?
The main injuries that you have present, which are common in CPR, are fractured ribs. We see it a lot. And the older you are, the more likely you are to have fractured ribs. Young people tend to do a bit better, but in CPR, it's not a criticism of anyone. They're doing their best. It's a very emotional event. You're trying to recover someone. Sometimes people press too hard, and they regret ribs.
Showing counsel states 1T for identification. Doctor, I'm showing you states 1T for identification. Do you recognize this photograph?
I do.
And aside from the fact that the breasts of the individual in this photograph are pixelated, does this fairly and accurately depict the body of Luciana Fernandez at the time that she was autopsied?
It does.
At this time, I move states 1T for identification into evidence.
Objection.
State Exhibit 1T, previously marked for identification, will become State Exhibit 115.
May the doctor stand down?
Yes.
Doctor, can you please point out the location location of the injuries that you're talking about that would be consistent with her having sustained CPR?
To the central chest, you'll see a red mark, a red abrasion, and that's very typical of the device. It's called a Lucas device.
Called a what device?
Lucas, L-U-C-A-S, Lucas device. It will artificially compress the chest, and it will cause abrasions. They are not itself harmful. A reflection of friction. You cannot see broken ribs, of course, but there are broken present. And on her right arm, you see an IV access.
Did Ms. Fernandez have any injuries to her head?
Yes.
Can you describe those injuries, please?
So she has a pink abrasion on the left side of her forehead, which was 1 by 0.5 centimeters. She had hemorrhage coming from both her nose, nears, N-A-R-E-S. She had a faint blue contusion on the bridge of her nose. She has an abrasion and bruising to the right side of her mouth. Lower lip was swollen. The right side of the inside of her gum, called the labial, L-A-B-I-A-L, mucosa, M-U-C-O-S-A, had bruising or contusions. They're also present on the lower aspect, so the upper and lower part of her inside of her mouth. The ventral aspect of the left side, that's the top of her left side of her tongue, also had a bruise. She had bruising present on the right side, left side, and on the front of her scalp. So in this area, she had bruising. And the right temporalis muscle, which is on the right side of your head, had also bruising. And there was bruising on the left side of the temporalis, which is on the left side of the head.
The bruising to her head, is that consistent with what's known as blunt force trauma?
Pay close attention here. The witness isn't simply listing injuries anymore. He's starting to reconstruct a possible sequence of events. Prosecutors love this kind of testimony because it helps connect individual injuries into a narrative. But remember, terms like most likely are important. Expert witnesses can offer opinions based on evidence, yet jurors ultimately decide how much weight those opinions deserve.
In this case, it's likely. I have not seen any other particular reason why it should be there.
Did Ms. Fernandez have any injuries to her neck area?
She did. On the posterior aspect, the back of the neck, high up in the first cervical vertebrae, there's focal hemorrhage. So deep in the back of the neck, if you go into the deep muscles, there was bruising right there, up high at the top of the neck.
Are you able to make any extrapolation of the fact that she had the bruising across the top of her head and then the bruising high up on the base of her neck?
You would have to take several things together. There's bruising on the right side as well of the mouth, and there was a thing called surgical emphysema, which is air present on the right side of the mouth. There's bruising to the head, and there's bruising to the back of the neck, deep. To me, would suggest in this case that when the incident occurred, most likely was propelled forward, striking possibly the front of her face or head, which compressed the neck.
Were there any injuries to Ms. Fernandez's torso, meaning the front and or her back?
Yes. On the lower aspect of her left side of her back, there were red abrasions. Towards the middle of the lower back, there's also abrasions. And on the right buttock or gluteal region, there's also abrasions.
For the record, I'm showing counsel states 1U for identification. Doctor, I'm showing you states 1U for identification. Does this fairly and accurately depict the body or the back part of the body of Ms. Fernandez when she was autopsied?
It does.
This time I move states 1U for identification and evidence.
Same objection.
State Exhibit 1U, previously marked for identification, will become State Exhibit number 116.
Doctor, could you step down for a moment, please? Around Ms. Fernandez's back, we see it seems to be some level of discoloration. Can you explain to the members of the jury what we might be looking at here?
This is called postmortem lividity or discoloration. So when we pass away, our circulation stops. Blood will settle out of the blood vessels in the line of gravity. So if you're lying on your back and you pass away, you continue lying on your back for a number of hours, the blood will settle towards gravity. So that discoloration is that red blood cells coming out of blood vessels and settling into the tissue.
Did Ms. Fernandez also have any blunt force injuries to her arms or her legs?
She did. She had several bruises to her upper arms, left and right. She also had abrasions to her right hip on the right side. There were also a number of bruises and abrasions on both lower legs, left and right.
Was an internal examination conducted on
Yes.
Ms. Fernandez's body?
Yes, it was.
Can you explain what how that type of an internal examination would be conducted?
So the autopsy has many aspects. First of all, you get the information that is available at the start, so that would be the equivalent of your primary care doctor reviewing your chart before they go to examine you. The second part is that we do the external examination, so you're looking for signs of natural disease, injuries, clues to give you some idea of what you might be dealing with. And then we move to an internal examination, and the internal examination involves getting access to the body to examine all of the organs. That's all of them, from brain, neck, chest, abdomen.
This may be the most educational part of the entire testimony. The doctor explains that drowning is often a diagnosis of exclusion. In other words, investigators don't just prove drowning. They systematically rule out other possible causes of death first. Heart attack, drug overdose, medical emergency. Those possibilities have to be examined before arriving at a final conclusion. That's a critical piece of forensic reasoning.
We go through all of your organs in detail, looking for disease, injuries, or clues as to why this person may have passed away.
Were the findings both from the external and internal examination of Ms. Fernandez's body consistent with her having blunt force trauma, perhaps to the head, and then subsequently drowning if she was in water?
Yes, so drowning is a diagnosis of exclusion. There is nothing in an autopsy that you will do and point your finger and go, aha, this is drowning. Drowning is a diagnosis of exclusion. It means that you must have ruled out.
Here comes a potentially important issue for the jury. Toxicology found no drugs or alcohol, but the prosecutor immediately explores whether alcohol could have been consumed earlier and simply no longer be detectable. That's a subtle but strategic question. The answer could affect how jurors view the events leading up to the incident. What do you think? Does the absence of alcohol in testing completely settle the issue or leave room for uncertainty?
Other causes for the death, if I may explain. Anybody could be in water, swimming, walking, and have a heart attack, for example. If the heart attack is your cause of death and you happen to be in water, then it's not that you've drowned, it's that you've suffered an event which has put you in a dangerous environment. So that's the reason why. We also would look at to make sure you're not intoxicated or there's some other reason that you didn't get out of the water. So once you have ruled out other causes, and the only thing you're left with is the environment to where the person was found, in this case underwater, in the result of an event that happened with a boat, we can reasonably conclude that, having ruled everything else out, that the cause of death is drowning.
Now, was a toxicology screening conducted of Ms. Fernandez's blood?
Yes, all cases get screening.
The blood sample that was used, was that antemortem or postmortem, meaning prior to death or after death?
It was antemortem.
Was the tube of blood that was analyzed, or tubes of blood that were analyzed in this matter, dated and given a time?
Yes, they all are when they're antemortem, and in this case it was the September 4, 2022, and the hour was 20 hours and 28 minutes, which is 28 minutes past 8 p.m.
And was the packaging of those tubes of blood consistent with the blood having been drawn at a hospital?
Yes.
What were the results of that toxicology testing?
A comprehensive screen for drugs and alcohol was performed, as is in all cases, and in this case there were no drugs or alcohol detected.
Now, if that's the case, does that rule out the possibility that Ms. Fernandez could have consumed alcohol earlier that day?
It does not, no.
Okay. Can you explain to the jurors why it might be possible that she could have consumed alcohol earlier in the day, yet by the time 8:30 rolls around, no alcohol is found in her body?
Objection 401, 403.
I'm sorry.